Hi, I'm Steven. You can now watch UCF TV 24 hours a day on Bright House Digital Channel 1.
This program was made possible by a grant from the UCF College of Health and Public Affairs, which promotes excellence in undergraduate and graduate education, research, and community service in health-related professions and public affairs.
Hello once again. Thanks for joining us for yet another edition of For Your Health. I'm Ed Highland.
And I'm Charna Davis-Wiese. Today we'll take an in-depth look at the problems and solutions needed to tackle severe disabilities in reading and writing. Plus, our Career Corner will look at the fascinating opportunities in the field of speech-language therapy.
Details coming up, but first we'll check in for the latest from the UCF College of Health and Public Affairs.
Protecting our health is the goal of ongoing research into new ways to create vaccines. A UCF scientist is using a novel approach to actually grow a vaccine that could be used on the war on terror.
One of the primary goals of our research is to produce vaccines and therapeutic proteins for like insulin or interferon for treatment of diabetes and hepatitis and so on in plants. Also, anthrax vaccine is very much in need, primarily because of the bioterrorism concerns. And in the US, only one company right now has the capacity to produce this. And they produce this in very small quantities simply because it is produced using fermenters. And they also use the pathogenic organism, the Bacillus anthracis, that causes the disease. What we tried to do was clone the gene for the protective antigen and produce it in plants. That means plants do not have the toxin component at all. So we produce a very clean vaccine, and we first chose to do this in tobacco simply because 1 acre of tobacco with 3 cuttings produces about 40 metric tons of leaves. And so once we produce the vaccine in tobacco, we extracted the vaccine using the similar procedures that is currently used, and then we injected the vaccine into mice, and we checked the mice for the immunity, and the immunity that they showed was quite high. The titers were somewhere between 300 and 400,000. Usually you need only 1,500 to 2,000 for effective protection against the lethal toxin or against the anthrax spores. So we shipped the mice, several batches of mice, to National Institutes of Health because they have the facility to challenge these mice with the toxin and the spores. So when they challenged it, because of the high immunity that we obtained in the animals, they went for a very high level of challenge. Usually they do about 15 to 20 microgram challenge, but in this case they went for 150 microgram of toxin challenge because they believed that the data was quite good. And 100% of the animals of all the batches that we sent survived the toxin challenge. So basically now, according to their estimation, 1 acre of these transgenic plants can produce 360 million doses of anthrax vaccine.
Dr. Daniel also says he believes this approach can help mass-produce drugs to treat diabetes and cancer.
Well, from the lab to the emergency room, Central Florida hospitals play a critical role in everything from research to lifestyle modification. Today we'll focus in on what's being done to help your heart stay healthy.
Doctors have always been challenged by the need to know what's going on inside the soft organs of the body. And finding out has often meant inserting a catheter or doing exploratory surgery.
Keep holding your breath, don't breathe.
Now, Florida Hospital in Orlando is offering a high-tech alternative, a fast, three-dimensional CT scanner called a 64-slice Lightspeed VCT.
You will know at the end of all of the processing of those images whether you have hard plaque, which can be calcified enough to see or not on X-ray in the initial plain scan. And then with contrast material, we'll be able to see if there's any soft plaque in there. So if there's soft plaque and your artery is restricted from blood flowing through it, then that's where you want to go see a cardiologist and get treated.
It can be used on any part of the body, from stroke assessments in the head to soft tissue damage in the leg. Not only is it useful for diagnosis,
Are those white spots calcium? Yes. Ooh, that's not good.
but it gives physicians and patients an option for early detection of partially blocked arteries that could lead to heart attacks. Early detection can lead to early treatment and prevention. This is Jerry Klein for Your Health.
Too often we take the simple things for granted, like being able to eat and swallow or read and write.
Jane Lieberman heads the UCF Department of Communication Sciences and Disorders to help those with speech, language, and hearing disorders. Thank you so much for joining us today, Jane.
Thank you.
Let's talk a little bit about the NIH. And recently they've declared issues with reading disabilities as the nation's #1 health problem. What are your feelings on that?
Well, I agree with them, and I think there are probably 2 reasons why they have tagged reading disabilities as the nation's #1 health problem. First, we have a large segment of our population that's having difficulty with reading. Approximately 60% of children are having difficulty in school, and 30% of those really struggle when they learn to read. Reading not only affects them educationally, it's going to affect them vocationally as well. They're not going to be able to prepare for the particular jobs that they might want to have. So there's an overarching issue with reading disabilities in terms of vocation, social interactions. These children are much more likely to drop out of school before they finish high school, even though they may be very smart and highly intelligent. And once they're out of school, they're more likely to end up in the judicial system. The problems affect their mental health. Many of them have very low self-esteem because they haven't learned to read and they don't know why.
And it's not just that they're not being taught well or not working hard enough. They actually have problems. There are a number of different problems. So many of us think of dyslexia, but that's really only one of a number of problems.
Absolutely, and it's very important that we differentially diagnose these children because, as you mentioned, there are a number of different profiles. For example, there are children who have very broad-based language disorders at the spoken level and also at the written level. These kids had difficulty as they were growing up with vocabulary development, with sentence structure, with comprehending what was said to them. Now these children, for example, when they begin to read, may also have the written problems on top of the spoken language problems, these are the kids who we call language learning disabled. You mentioned dyslexia earlier. With dyslexic children, oftentimes their spoken language is very good, and we don't see any problem until they begin to read. And then they have difficulty recognizing words, they have difficulty with sound symbol correspondences, but their comprehension is always pretty good. But each profile requires a different kind of treatment.
Now, you're a speech-language pathologist. First, tell us exactly what that means and what role the speech-language pathologist plays in helping kids with reading issues.
In the past, we've worked primarily with listening and speaking, but reading and writing is just speech written down. One of our primary tasks is prevention. 95% of the reading disabilities that we see can be prevented or reduced, and these are reading disabilities due to environmental factors.
So ideas, what can we do for prevention?
Well, for prevention, there are a lot of things that we can do. The first thing is early identification, noticing that a child is at risk for a reading disability. And there are lots of signs that children show. Very young children are going to have difficulty learning language, and so we need to put them in a very rich language environment. We need to speak to them, and that means that we have to identify them and put them in programs that will help them to develop.
Now, you mentioned environmental early on. Now, was that when you're talking about language-rich environment? Is that different than environment, meaning some of the surroundings, things in the soil, for example?
Yes, it's very different. When I talk about the environment, I'm talking about books, magazines, television. There are many children who don't have access to these kinds of materials because they may come from a home that's economically impoverished, or they may be second language learners, or they may be from an underrepresented group of individuals. These kids are at high risk for reading disabilities. But the good news is that these are the kinds of reading disabilities that we can prevent by altering that environment, getting them into school-based kinds of activities where they have books and they have print materials and they have people to talk with them.
Years ago, I did a story on a grown man who was later diagnosed as having dyslexia, and he recalled that when he was a child, he had problems reading, and then he would get punished, or he'd be in trouble because he'd have problems reading, and it became such a cycle of guilt and taking responsibility for something that he really could not control and needed help for. Do you see that a lot of times? And people don't realize, well, it's dyslexia. It's not that this child is not trying.
Absolutely. And that's what the NIH researchers meant by the #1 health problem. It causes all sorts of anxiety, social issues, beginning to think that, well, maybe I really am dumb. I just can't get this.
And there's different levels, are there not? I mean,
Oh,
you can
absolutely.
have a mild case, if you will call it, and so therefore it may take a different type of treatment and also may go unrecognized for a longer period of time.
That's absolutely true. And what our goal is today is to get these problems recognized as early as we can, because the earlier we identify them and start to treat them, the faster we're going to resolve them and the less time it's going to take. I wanted to respond to you about the adult who you met many years ago. We can work with adults. We're not just limited to working with children. Adults who haven't had good instruction have the same kinds of problems as children, but we just need to use different materials.
And we'll talk more about that when we come back.
We're back talking with Jane Lieberman of the UCF Department of Communication Sciences and Disorders. Thanks so much again for joining us, Jane. Give us a little bit of an idea of what kinds of things you can do for people.
Absolutely. Well, first I want to make you aware that we have a communication disorders clinic on campus. It's located in the Research Park, and one of our specialty areas is working with children and adults who have severe reading and writing disabilities. Dr. Sally Ann Geis is our major person in charge of that area. We do comprehensive evaluations, children or adults, and in those evaluations we're trying to figure out what's going on with the individuals, and then from there we do treatment planning. Some of the people who we see stay on to work with us. Others go back to their schools or back to a private practitioner either in the greater Orlando area, or some come from afar. In our clinic we are doing treatment, and we use a variety of methods depending upon what the problem is. With our dyslexic individuals, we're using a multisensory approach, because these are the kinds of individuals who need very explicit instruction. We can't leave anything to chance.
Multisensory meaning computer, visual, audio, is that what you mean?
Well, you stimulate the sensory system through vision, through tactile kinesthetic, through auditory, hoping that a combination of those sensory modalities will get in.
Is it something that's always evolving? Are you always learning more, always coming up with new ways to treat and improve their ability to be more cognitive?
Well, I would say that in any profession it's always evolving, but the National Reading Panel has come out with recommendations for a balanced approach to reading. And what that means is that in any kind of instructional package, you're going to have activities related to comprehension, activities related to fluency, to decoding, word recognition, to something that we call phonological awareness, or sensitivity to the sound structure of language, how sounds hook up with the symbols to make words. So we want to have all of that involved. And then we're doing a lot of research to find out which methods work best for which children. There isn't a one-size-fits-all.
You know what really worries me, though, when we think about is so many that can't read and so many that have problems, and such very heavy volume of children, so many kids in these classes, so many kids going throughout the system. Are there signs that a parent can look for, maybe the teacher has missed, that this child has a disorder?
Again, we want them to spot them very early, at 2, 3 years of age, and at that age what you look for is their language development. Are they speaking in sentences? Is their vocabulary developing? Do they like to tell stories? Do they like rhymes and jingles? When they get into preschool and kindergarten, you want to see how they interact with books. Do they know that a book has a cover and a back, a top and a bottom? It has pages in it. When they look at the book, do they know that print goes from left to right, from top to bottom? Do they see that there are words on a page that are divided up by spaces? The earlier the better, absolutely. We want to get these kids at 2, 3 years of age, because what we can do then is get them ready for first grade. We can prevent, as I said earlier, 95% of reading disabilities.
You're saying 2 and 3 years of age. I mean, that's not usually considered a big reading age. You can really evaluate at that point whether or not a child is looking at the world the same way they should be looking at it.
Because we're looking at the precursors to reading. Reading is built on a strong spoken language foundation. And so children who struggle with spoken language are likely to have reading problems. And the kinds of things that we do with them are so enjoyable and so engaging that if perchance we identify a child at risk who ends up okay, we're not going to do anything that's going to be invasive or unsatisfying.
For somebody, an older child, teenager, even adult, that is really working hard and just can't grasp it, is there a way that they can get to you or say, take a look at me, I want to know, or take a look at my child, I want to know what we can do if there's a problem here that can be treated?
Oh, absolutely. They just need to call the UCF Communication Disorders Clinic and make an appointment, because we can help them. We can work just as readily with adults as we can with children, and we can be just as successful with adults as we can with children. But as you mentioned, it does take longer, and that's why we want to get in there early. I think what distresses me the most is that we have had the knowledge about how to help these children and adults for some 25 years, but it hasn't been translated into our university teacher education programs. And so if we encounter adolescents or adults who are struggling, more than likely they haven't received the particular kind of instruction that they need in order to be successful
Perhaps
with
this
reading.
designation by NIH as a #1 health problem will speed the process along and bring more recognition to it.
Oh, it has already brought a lot of recognition to it.
Great. Thank you so much, Jane Lieberman, for joining us today.
Thank you.
Thank you.
Growing health sciences campus is but one reason why we are seeing big jumps in demand for training health professionals. We zero in on another option to consider in our career segment.
So if you open your mouth,
Trouble pronouncing certain letters, voice disorders, stuttering. These are speech and language problems, and they're a lot more common than you might think.
Speech and language disorders do not discriminate. You're going to find it in young kids, adults, people of different racial backgrounds, different socioeconomic levels. You're going to find that no matter who the person is, it can be a problem for anybody.
In fact, that is, in a way, what drew Jennifer Olfke to be a speech and language pathologist.
I knew I wanted to work with people. I knew I wanted to work in a way that I could help people. And one week we had a speech and language pathologist come in and describe what they do for a living, and I was just hooked from that point on, and I said, this is what I want to do.
There are a lot of different causes behind speech problems, things ranging from accidents to stroke. But Olfke primarily works with children, which changes the scope of possible causes.
But for a child, a lot of times it can be developmental. It's something that may have occurred in the womb. It could be, after they were born, there could have been trauma at birth. So there's just a variety of different ways that a child can end up with a speech or language problem.
Speech pathology is a field that has benefited from heavy research over the years, but there are constantly breakthroughs on the horizon.
And right now we're in a critical research time for communication disorders. There's been a boom in research, and it just continues to come, and so there's really a need for researchers. But it's very important to keep up on that because we constantly see different kinds of kids coming in here, and it's really critical to know what we're working with and what therapies work. You can do so many different things as a speech and language pathologist, and if you get to a point in your career where you're thinking, I don't know if I want to do this anymore, but I'd rather do this, or I'd rather be in this setting, you can change your setting but still be a speech and language pathologist. So there's much more variety without changing your whole career path.
Right hand, left toe, right hand.
It's a career that demands patience. Working with children can sometimes mean dealing with behavioral problems. But Olfke says what she finds most challenging is being patient with herself, because sometimes she doesn't get the results as quickly as she'd like. But that's just part of the job she clearly loves.
I just knew that there were so many different people that could be benefited by someone who was a speech and language pathologist. And I think the enthusiasm of the person that came in the class and taught and told us all about what it meant to be a speech therapist and what it entailed, I don't know, there was something clicked and said, this is what I want to do.
Hard?
For your health, I'm Alicia Callanan Mandigo.
For more career information, you can check out the College of Health and Public Affairs webpage at www.copa.ucf.edu.
Plenty of careers, but only enough time to say thanks for joining us on For Your Health. I'm Charna Davis-Wiese.
And I'm Ed Highland. We'll see you next time.